Greetings from Rotary Club of McKinney. I have Pete McLellan with me, who is also a past president and assistant governor. I am a past president and committee chair for the International Service Projects. About 3 years ago, Rotary Club of McKinney decided to do at least one international major projects. The first one was we sent about 100 wheelchairs to Nicaragua. And then in 2012, during my presidency, we had a 6-doctor team came from Africa. So you can go and start.
Yeah, we're going to start showing that.
Yeah. And those 6 doctors were from one district, and that particular district had 5 different countries. You know, our governors complain about 60, 65 clubs, and this particular club had 5 countries. So these doctors came as part of the VTT team, vocational training team, to our club, 5810. We hosted those doctors in houses of the Rotarians, and 2 of them stayed with me, 2 doctors stayed with Pete. So we had a great time.
This is slide number 3 of our presentation, and it basically shows, if you look over at the map of the African continent, down in the southeast quadrant, you can see that's where the doctors came from Malawi, Mozambique, Zambia, and Zimbabwe. And if you go to the next slide, you can actually see the doctors who were represented. And yeah, they were great.
They were at the conference.
Yes, that's right.
Yes.
Yep.
They were all medical doctors, you know, surgeons, and working in different countries with a lot of experience and expertise. And the next slide will show you the purpose of their visit.
I texted Priska after Saturday, and she said they were very humbled.
Yeah. So you can see the Group Study Exchange, GSC or VTT is the new name, I guess. The reason why they came is to study the medical and health systems in this country. They visited different hospitals, different doctors, clinics, and they learned so much. So go to the next slide. So what happened was in our club in McKinney, one of our Rotarian is Scott Peak, who is the CEO of Baylor McKinney. So he was gracious enough to take myself and all the doctors to his hospital and give us a tour. And the doctors, you know, some of them are surgeons. You know, they wanted to go inside the operating rooms, and they fitted us in this monkey suits. So we went inside, and one of the surgeons' highlight was he saw a robot who is doing the surgery. He said, I learned this in my medical school, but I never seen a robot. So he hugged the robot and asked me to take a picture. So he was so excited to see the robot. And, you know, they gave us a tour and all those kind of things. And when we came out of the operating room, you can see, you know, I'm not a doctor, but I'm there also with the monkey suit. Scott Peak, who is the CEO, asked you know, the doctors to take out the monkey suit, and here is Scott is with the doctors, Scott Peak.
Also was a member of our McKinney Rotary Club.
Yeah, he is a member of the McKinney Rotary Club. So when we, one of the nurses came and took out this monkey suit to throw it away in the trash, and one of the surgeons ran and said, oh, give it to me. I will take it home because we can use it for 6 months. So you can imagine, and then they started to explain, you know, how shortage of supplies and equipments and all those kind of things. And then I thought about, hey man, we need to do something for these people. So you can go to the next slide. That's when, at that time, Donna Cole, who is a Rotarian of McKinney Sunrise Club, he was working at that time for the hospitals in McKinney. So I asked him about, you know, how can we help? Then he gave me the name of Dr. Don Sewell, who is also working for the Baylor hospitals. they have a program where they help international entities and all kinds of Rotary clubs and those kind of things by providing equipments and supplies and all those kind of things. And he invited me to go to their warehouse. When we went there, these two warehouses is actually as big as 2 football fields. It's right here in downtown Dallas.
Really?
They're packed with supplies, and they send at least 1 or 2 shipments to different countries every week.
Wow.
I mean, this thing is huge. So, and I explained, Dr. Don Sewell about our desire to send some products, and he agreed. And you can see in that picture, Dr. Mac Hill, he is a Rotarian who is 95 years old, who is still active Rotarian.
He's the first pediatrician in the city of McKinney.
In Collin County.
Wow.
In Collin County.
Yeah.
In Collin County. Dr. Don Sewell, who is in charge of this project. Then you can see Donna's Cole, he was also an assistant governor. Then myself and Dr. Jerry Sims, who is also a Rotarian, practicing doctor from McKinney. So we went there, look at all these supplies. I mean, literally thousands and thousands of boxes. So the doctors picked, what will be beneficial for Zimbabwe.
Go to the next
And
one.
we can go see the next one. So the Zimbabwe Rotary International Project, the whole supplies and equipments were given by the Baylor system. Did not cost us a dime. You can see the District 5810 gave us a matching grant of $4,000. Garland Rotary Club, Grand Prairie, McKinney Our Club, McKinney Sunrise, Plano Metro, Richardson Rotary Club. And the cost is $9,000 to ship this 20-foot container. That was the only cost for the clubs. So if you go to the next, one 20-foot container. If you see a 20-foot container, that thing can quite a lot of products.
You can see the container
So
on the
you
lower
can see
right.
the container.
Yeah.
So the estimated value of this medical equipment is $125,000. So that's the value of the things we sent. So containers, boxes after boxes.
That's the value here in the U.S.
Yes.
That's right.
There it's priceless.
It's priceless.
It's
And you can see how they used it. You can go to the next
Now
step.
you can see by looking at the slide, go back to that last slide. You can see in the upper left-hand corner, there was an operating bed, platform, bed, whatever you want to call it. But that was surplus equipment because they have upgraded to the latest and greatest technology and so forth. And you can see they did a wrap on all the boxes, and in those boxes was medical supplies, there were blankets,
Equipment.
there were sheets, there were, you name it, they included it. And then it absolutely filled up that container over on the right side.
You can go to the next slide.
Yeah.
I bought a $63,000 blood tester,
Uh-huh.
used $341.
Is that right?
And they made sure that all these equipments are in working condition. So they
Yeah.
have technicians, who will do that. You can go to the next slide. This is Don Sewell. What they do is, I don't know how many people have sent, products overseas. Once the container is locked, that red tag is the final. The person who is authorized to receive the product is the only one who can cut open that official shipping tag.
Each
So-
one is identified
Yeah.
and matches the shipment of lading that goes with it, so that they know that if that has been tampered with, that they're missing some
And
items.
we want to make sure that these things don't end up in black market or all those kind of things, and we knew that. So that's that red tag. I'm standing with the Dr. Don with that next tag. You go to the next slide. Now it took almost 70 days to reach the products to Western Harare. Harare West is a city in Zimbabwe. The Rotary Club of Harare West is our receiving club. So they did
receiving
everything.
partner.
And now the thing is, the assistant governor of that that district owned this Speedlink cargo. So we did not have to pay to ship the products from the dock to the warehouse, so he took care of that.
And he also made sure that the container didn't make any unscheduled stops.
That's right.
So it went right from the container to his truck.
So I
And
was
then he
hoping
brought
that
it
it will
in.
reach there on Christmas time, but it was 1 month late, but it got there on January 30th. So go to the next slide. Now these products were distributed to 5 different hospitals and clinics. You can see the name of those places. You know, so this was Dr. Friska, who was the VTT member, and the governor, and all these people were actively involved with these things, and divided all these products to 5 different hospitals and clinics. You can go to the next one. You can see how happy those people are. You know, these are some of the people who was there. You can see those 3 people who is sitting there. At that time, they had exchange students when they received this product
From France
from
and
France.
England.
Yeah, so they helped to distribute, to carry this distribution to the in different clinics.
You can see Dr. Priska there.
Yeah, she's standing right there, and they were so happy. You can go to the next level. You can see the Rotarians and family of Rotary organizing the allocations. I mean, you know, it was a happy time for them. You know, they had the Rotarians' parents and wives and kids. I mean, I got a report for about 18 pages. I mean, it's unbelievable. I could not put everything in there.
This is their verbiage
Yeah.
up here. That's not mine.
Rotarians and family of Rotary organizing the allocations. You know, there were people involved.
With their
Spelled
spelling.
the English way.
With their spelling.
It's
That's
the
right.
English
That's
way.
right.
It's the
Yeah.
English way.
Yeah. Okay, so you can go to the next one. You can see Rotarian Andy House and President Elizabeth Mukadiwa presented a delivery of medical supplies for the clinic at J. Rose Jury in Lytton Road. A room full of very happy singing children and clearly evident family spirit. You can see
That's
how,
like a children's clinic.
yeah, I mean, you know, how happy these people were. A very humbling experience for us all from Rotary Harare West. So they were our partners there in Zimbabwe. You can see the people, kids, and these are all supplies. You know, look at all those. Yeah, go to the next one. Yeah, you have people on the wheelchairs. They are patients. You know, walkers, all kinds of things. You can go to the next one. So you can see, you know, this is some of the products. You know, when you see that 20-foot container, you don't feel like it can hold this much stuff. I mean,
Oh,
they
boy.
pack this thing. I mean, they pack it so well. You can see computers and MRI machines, beds, stands, all kinds of things. And we equipped these operating theaters with the products came from here.
Now, since they didn't have this type of equipment, who was the ones that put it all together for them?
They have people to do that.
They had people.
They have people to do that. You know, you can see the operating theaters. This is one of the hospitals which they distributed the products. Go to the next one.
Next slide.
Okay, you can see the Catholic nuns and sisters and parents and doctors and all those people. Such a happy occasion and much appreciated. Thank you, Baylor and Rotary District 5810. That is our district, you know, who helped us to put this thing together. You can go to the next slide. You can see how many different groups of people who was involved in these projects. It took, you know, us 2 years. You know, of course, the Malawi, Northern Mozambique, you know, that one district. Stella Dango, district governor, district Rotary Foundation chair, Sherry Coleman, they are all from Zimbabwe. Then the Harare West Rotarians, you know, those are the name of the Rotarians who was directly involved with this thing. Of course, then our 5810.
And it all started with the VTT
That's
program.
correct. You can
So-
see our 5810 governor and past governor and all those people. Then, of course, Baylor Healthcare Systems. Those are the people from Baylor. Rotary International, you know, because of we want to make sure that all these things are transparent. You know, I made sure that Rotary International people were involved. So Elena Kushner, and then we had, then we called Switzerland region, who is in charge of Africa. I want to make sure that this goes to the right place. They were involved. And Rotary Club of McKinney, our president, you know, president-elect, including Pete, myself, Mark Yablon, all those people were involved. It took almost 2 years, but I tell you what, when we got that letter from them, it was very gratifying. You know, so many people had taken advantage. of all these things, and they were very, very thankful, for what we did. It took almost 2 years, and I said I made hundreds of telephone calls, international, national, and guess what? Another thing is the shipment is left Dallas. We wire transferred $9,000 to the shipping company. Then I got an email from our district, stop it. Don't do it because State Department put us on a hold because in some kind of terrorist list, Zimbabwe is on the list. You can see, that is a sign came from there. Help us to help others. So that's what we did. We helped them to help others. This is not our sign.
That's the Rotary Club of Harare West.
It's
That's
their sign.
Poster.
And that's in Zimbabwe.
In Zimbabwe,
right.
yeah. It says to help us, to help others, and that's what we did.
I think that's a great motto.
It is.
Okay, here it
There you
is,
go.
2015-16 Rotary Club of McKinney International Service Project. You can go to the next slide. We can briefly. We have selected a St. Thomas Asylum in southern India. You can see on the map of India, it's all the way in the bottom, that circle, that's the state of Kerala.
Okay.
You might explain that asylum doesn't necessarily
That's right.
mean a
The na-
mental
that's right.
asylum. It means
the-
rehabilitation.
That's right. It's, you can go to the next, even I can
How do
explain.
you all go about selecting
I am from that town.
Okay, okay.
Okay, and my family's been supporting this particular organization for a long time.
Cool.
And this was actually founded in 1925. I was so impressed with the operations of this place, operated by St. Joseph Sisters, and the purpose is right now they are serving 75 physically, socially, and financially underprivileged women only, by providing equipment and tools to enable long-term financial sustainability. They live there. More than half of them have all kinds of sickness and disabilities and those kind of things. But these sisters are doing a fantastic job, feeding them, keeping them, and giving medicine. And I went to the kitchen. I'm a restaurateur. I never seen a clean kitchen like that. They do a wonderful, wonderful job. So 75 women only, and these sisters are struggling. And you can go to the
They
next.
do various tasks. They put together books. They
See, they have. You
all
can see
kinds of
that
different
they have a
types
tailoring unit.
occupations.
They have a printing press and all those kind of things. About half of these people there, they are mobile, so they go there and work, and that is one of their sources of income. So usually, I understand that Rotary clubs don't give money just for operations. So the sustainability is the key. So they need to sustain, so this will increase their income. So they gave me a project report for the whole thing. If we can provide all these items which will increase the productivity and revenue of their rehab center. Mm-hmm. So the total, you can see those are the list of the things they like to have. You can go to the next, go back. So the total project is $18,279.
US.
That is the US dollars is the package. What I like to do is our Rotary Club of McKinney committed $4,000. That means we hopefully will get another $4,000 from as the grant, matching grant. So that'll be $8,000.
And then we suggest you do for global.
That's right. Well, I don't know. If I talk to different people.
Okay.
I know Ian said, but our key people are not recommending that because I'll talk about that. Anyway, so I'm hoping we have about 60 clubs in our district. I'm hoping support from all the clubs. Whatever they can do, $200, $300, $500, $1,000. I like to meet that $18,000 with our $8,000 from our club. And then you can go to the next slide. I went and talked to the local Rotary Club, number 4. It's Etumanur District 3211. I spoke in the club and I explained the situation to them, and they agreed to be a co-sponsor. And also, usually that don't happen from the third world country. They offered 100,000 rupees, which is about $1,600, which is a lot of money for them. So they will be part of the financial project also. And we are seeking Rotary District 5810. project partners, that's our 60 clubs, finalize the fundraising needs. So we are willing to do this presentation to all our clubs whenever they allow us to do, because we need assistance. Secure district grant, and that will happen. We are working on that. And that local club happily agreed to be part of the deal. And then they will monitor the project implementation. That's an important thing. So that district and that district governor will be working with us to make sure all those products are bought and delivered and installed. We get receipts and all those kind of things. So that part is already done.
What happens if some of the products are just donated?
Well, the problem with that is, you see, so there are computers, those kind of things, all these things are available there. The problem is if we take any kind of equipment from here to there, the warranty and service and those kind of things. India is technically very advanced. They just don't have the money. There are people to do it, things are available.
A lot of it's sourced there.
That's right. So I think the best thing, we used to send computers and those kind of things. You don't need that anymore. Actually, computers and those kind of things are cheaper there, and they're making it there.
So the money goes.
Money goes there. Make sure somebody's in charge, and luckily we have that club, and the district is part of the deal. So I don't have any problem. And I personally know from the Mother Superior, the bishop, and all those people. I know them because I'm from the town. So
you know where to find them.
I'll find the bishop.
And they know how to find him.
That's right. So that's the project. Like I said, we do need help from the other clubs, and I already got dates from 6 other clubs, and we will go do the presentation. We like to request you also to be part of the deal, whatever you can do.
I think this is going to be one of our first international projects.
But I think we need to have some kind of education to Rotarians also. Look, we are not just local.
Right.
Go to the next slide.
Okay, go to the next slide.
Learn quickly what you have to do.
Yeah.
This slide kind of shows you those Rotary partners that have already expressed an interest in participating. So we've definitely got some support from the McKinney Sunrise Club. When we were down at the district conference, we had interest expressed by the Rotary Club of Duncanville, and we also have a partner in the Etumanor, India partner. So now we're saying who else might be interested in joining. And when we presented this at the district roundtable last week, we got a lot of interest from a lot of people.
What about going outside the district?
We'd be happy to do
India,
that.
and sometimes they do a lot.
See, the Rotarians need to understand, like you said, Rotary Club is not local, not national, it's international.
That's all
I
right.
think it's so important.
Oh,
I mean,
we'd be happy to.
$1,000 is a lot of money, those places.
But most aren't thinking that way.
Not thinking like that.
Well, not in the U.S.
We do a lot of local things, and that's about it. I think, we are more than happy to present this to anybody so people can see how much impact these kind of things will do to not just 1 or 2 people. When we help these 75 people,
Well, I wanted to
These
get this one
75
up
people-
because there's the contact information. If anybody out there that's viewing this E-Club,
and these 75 families, 75 people, it's their families, their extended families. They're all going to benefit from this thing. Because I see them, whenever I go at least once a year. And whatever I can do, I've been helping them for the last 10 years. And I think it's a good project. Our club decided to take this. So, thank you very much. Like I said, we are hoping that you will be part of this project.
And I'm hoping you will call us this Friday afternoon. I'll be waiting.
Well, there's no reason other
President-elect.
clubs.
Thank you. Thank you so much.
Other